Hi, Dr. Hizon again, here to talk about hypercholesterolemia and the documentation of that patient. As a general disclaimer, please refer to your particular doctor. This is a general course not intended to be medical treatment, and your particular situation may vary. So sometimes there are no symptoms of elevated cholesterol, but you can have chest pain, you can have small bumps on the skin, typically around the hands, eyes, and ears, and even around the knees. These are cholasma or xanthomas, waxy cholesterol deposits. You can have yellow deposits and cholesterol that can build underneath the eyes and around the eyelids. On the physical exam, it's a routine type thing, but they mostly have metabolic disease. Typically, they're above their ideal weight. We'll do history, physical exam, lab testing, and referral if necessary. The treatment is a lot of times lifestyle modifications with weight loss and exercise, improved nutrition, decrease alcohol, and maybe a change in their sodium. There's patient education, medications, and then regular visits with the provider. Typically, it's decreased weight and sodium intake, increased exercise and healthy diet, decreased alcohol, and medications can be the statin-type medicines like Lipitor and Crestor, bile acid binding resins, other cholesterol-absorbing inhibitors, and even some injectable medications. And usually they're getting labs done routinely, possibly every 3 months. Lifestyle, again, exercise and improved nutrition, medications, and follow up with their primary care medical provider. So on the documentation, typically a chief complaint would look something like this. A, say, 72-year-old female presents for follow-up on abnormal lab results or for her cholesterol. So again, Miss Jones is a 73-year-old female, presents today for evaluation of abnormal lab results and or for follow-up on lipid profile. You can talk about, does she have a specific way she eats? Does she have any symptoms? And then does she have any pain? And if so, what makes it worse? What makes it better? And we'll go through the template to look for any other symptoms. One of the things you want to do is make sure that you've documented treatments that she's had so far. Does she check anything on a daily basis, like her weight or her blood pressure? Is she on any certain medications? Has she had a physical exam, labs, and medications in the recent past? Does she see any specialists? Like, does she see an endocrinologist or a cardiologist? And then tobacco use, exercise, nutrition, sleep program, and constitutional symptoms are such as she gained or lost any weight since the last time we saw her. And then you can go through and step through all the different review of systems that you want to make sure you don't miss anything. On the objective finding, you give a general overview of how she's doing, and is she in mild, moderate, or severe distress. You might want to look for JVD as jugular venous distension if she has any elevated neck veins from heart failure. Does she have normal heart sounds? RRR is regular rate and rhythm. Does she have any murmurs, any extra heart sounds? Lung-wise, does she have any extra fluid, or is she clear to auscultation? Abdominal exam, we'll look for distension and hepatosplenomegaly. And then musculoskeletal, especially looking for a swelling of the lower extremities and the ankles. On the medical decision making, is it a simple or complicated case that requires straightforward or complex decision making? This is the time for the provider to give reasons and rationale for why they are treated in a certain way. On the ICD-10 codes, E78.0 is pure hypercholesterolemia. E78.00 with 2 zeros is pure hypercholesterolemia unspecified. And then as a screening test, that would be a Z code, Z13.220, which is an encounter for screening for lipid disorders. On the plan, lifestyle modification, medications, labs, follow up with your primary care medical provider, as well as any specialty. So on pearls and pitfalls of documenting for the patient with hypercholesterolemia, be sure to document any symptoms, previous treatments, as well as previous history. Please ask your doctor if you have any questions about the evaluation for this patient. And in primary care, be sure that you've documented the quality measures for prevention. The takeaway points is that cholesterol is a fatty substance that occurs naturally in the body. It needs to be at what I call the Goldilocks, not too high, not too low, just right. And the body sometimes makes too much of it and can be a risk factor for cardiovascular disease. It can be prevented by staying in a healthy diet and exercising daily. The initial treatment for high cholesterol should always be lifestyle changes, but then there's medications and sometimes referral to the specialist. And it's encouraged that the medical informatics specialists study hard to learn the various questions to ask to assist the provider in documenting for the patient with hypercholesterolemia. And as always, while we doctors save lives, you medical informatics specialists and scribes save doctors. Thank you.